I'm joined now by Dr. Marc Cornier and Dr. Daniel Bessesen, both on the Obesity Management Workshop. You are the co-chairs. Let's talk about this as a whole. Obesity is such a huge problem in our country today, and really how the Endocrine Society as a whole can tackle this issue.
Yes, the Endocrine Society last year decided that obesity would be a strategic initiative for the organization over the coming years. I currently serve as the chair of the Obesity Expert Task Force, which is trying to inform the society or provide advice about the directions that we should take. And we have a couple of areas that we want to focus on. One being the training of young physicians, young endocrinologists, and how to help people who struggle with their weight. And we're also planning on 2 scientific statements over the coming year to look at really what's the state of our knowledge about obesity and its treatment.
Well, can you talk to me specifically about what the workshop will highlight?
Yeah, so the workshop, again, to emphasize the importance of obesity and really the clinical management of obesity. And we've had some successful pre-conference workshops here for other conditions like type 2 diabetes. And so it was an obvious place to start with this obesity initiative. So the workshop is basically a one-day event to offer medical education on all areas of obesity, from some science behind the latest areas of interest to taking care of patients, from diet, exercise, pharmacotherapy, and then leading into surgical interventions as well.
So when you're talking about that clinical practice and actually discussing with patients, it's such a sensitive topic. I feel sometimes people go and their doctor doesn't say to them, "You're overweight." How can we change that, or do we need to change that?
Yeah, I think it's an important point. I think clinicians are worried about bringing the topic up. But actually, patients want to discuss this with their healthcare provider. They want advice and direction, and they want to understand the health benefits and health risks. So I think clinicians should not be afraid to bring the topic up in a non-judgmental way and to offer information.
And it's not just about this workshop. You have got really events going on all week discussing this very critical topic.
Absolutely. There are a number of scientific symposia. One on hot topic, which is the whole gut microbiome and how that relates to obesity. There's another very interesting scientific symposium on circadian rhythm disruption and how that impacts metabolism, body weight regulation. Certainly we know that sleep deprivation is a major issue in our society and is a definite contributor. We have, as always, many very important oral abstracts and poster presentations on the latest research, as well as clinical trial type of presentations as well.
And there's also a collaboration, I know, between the Endocrine Society and the Obesity Society. Can you talk to me about that partnership and how it might be really even more helpful?
Yeah, the Obesity Society is a smaller society that really focuses on obesity as a content area. And they have a number of individual scientists and clinicians who have focused their careers on that. The Endocrine Society represents a broader base of scientists and clinicians, but we feel like the Obesity Society is an important content expert partner that we work closely with to make sure that we're all giving a similar message in this area.
And the Obesity Society helped develop the content of the Obesity Workshop as well, in conjunction with the past president of the Obesity Society, Dr. Stephen Smith.
Well, it's such a critical topic. It's such a big problem in our country, and it's so great that everyone is coming together to help not just the physicians who are dealing with people, but the people who are impacted as well. Thank you so much, gentlemen.
You're welcome. Thank you.